Correct. And, our healthcare workers, they're strained. They have had to treat COVID patients for the last 19 months. And one of the problems that we have within the OACS sub-region is that, we do not have a lot of healthcare personnel. In fact, generally speaking, our healthcare services and personnel have been actually supplemented with Cuban nurses. But even Cuba itself is stretched in terms of providing nurses to the region. So you'll find that that is a problem. We have been building out our healthcare facilities, expanding our healthcare facilities rapidly. In fact, we just added a 75-bed hospital facility, but unfortunately, one of the problems that we're experiencing, which is similar to the challenges in other OASIS countries, is that we don't have enough healthcare personnel to man the new facility. So now we're now seeking to import nurses, possibly from India. We have approached the government of India to assist us in getting some nurses here. We're even looking within the diaspora to try and attract Antiguans in the diaspora, who have nursing experience and who are available to return here even temporarily. And we also employ retired nurses. So we have a problem in terms of, limited human resources. And again, we had spent an enormous amount of resources adding additional healthcare facilities. We established an IDC center, that is an infectious disease center, the additional 75-bed hospital, as I indicated. In fact, we have now about 3 beds per 1,000 of population. So whereas we have the physical infrastructure in place, we do have a shortage of personnel. In fact, part of that health infrastructure include a number of polyclinics, 2 of which were recently constructed, and these are like mini hospitals. But again, goes back to the issue of a shortage of human resources.
So in one of your inserts recently, you were speaking about the fact that your health facilities are full. We heard about Mount St. John, and there's another.
Right. So Mount St. John, the services there are stretched, but, they've been coping. As I said earlier, we have this 75-bed facility, which will capture the overflow from Mount St. John, and that's the principal hospital in the island, the main hospital facility. But again, the problem that we're having, is finding sufficient human resources in order to man that facility. So to date, we have not utilized it, but it's there already equipped to assist us in addressing any overflow from Mount St. John.